Hey, genuine followers and constructive critics. At the outset, I wish you and your beloved a safe journey in 2021. Two, in spite of the second coronavirus sweeping India with mortality rates. Its social activist and good-hearted preacher, Professor S. Suresh, back with sheer ecstasy for my 136th video on annual of publication on YouTube today, 19th May 2021, Wednesday. The topic for today is treatment and management of depression and allied ailments. Depression is a state of low mood and aversion to activity. It can affect a person's thoughts, behavior, motivation, feelings, and sense of well being. The core symptom of depression is said to be anhedonia, which refers to loss of interest or loss of feeling of pleasure in certain activities that usually bring joy to people. Depressed mood is a symptom of some mood disorders such as major depressive disorder or dysthymia. It's a normal temporary reaction to life events such as the loss of loved one, and it's also a symptom of some physical diseases and a side effect of some drugs and medical treatments also. It may feature sadness, difficulty in thinking and concentration, and a significant increase or decrease in appetite and a time spent sleeping. People experiencing depression may have feelings of dejection, hopelessness, and sometimes suicidal thoughts. It can either be short term or long term. Adversity in childhood, such as bereavement, neglect, mental abuse, physical abuse, sexual abuse, or the unequal parental treatment of siblings, can contribute to depression in adulthood. Childhood physical or sexual abuse, in particular, significantly correlates with the likelihood of experiencing depression over the victim's lifetime. Life events and changes that may influence depressed modes include, but are not limited to, childbirth, menopause, financial difficulties, unemployment, stress, such as from work, education, family, living conditions, etc., a medical diagnosis, cancer, HIV, etc., bullying, loss of loved one, natural disaster, social isolation, rape, relationship troubles, jealousy, separation, or catastrophic injury. Adolescents may be especially prone to experiencing a depressed mood following social rejection, peer pressure, or bullying. Globally, more than 264 million people of all ages suffer from depression. This is a whole figure. The global pandemic of COVID 19 has negatively impacted upon individuals' mental health, causing levels of depression to surge, reaching devastating heights. A study conducted by the University of Surrey in autumn 2019 and May June 2020 looked into the impact of COVID 19 upon young people's mental health. Study showed a significant rise in depression symptoms and reduction in overall well-being during lockdown, May-June 2020 compared to the previous autumn 2019. Levels of clinical depression in those surveyed in the study were found to have more than doubled, rising from 14.9% in autumn 2019 to 34.7% in May-June 2020. This study further emphasizes the correlation that certain life events have with the developing depression. Changes in personality or in one's social environment can affect levels of depression. High scores on the personality domain, neuroticism, makes the development of depression, depressive symptoms, as well as all kinds of depression diagnosis more likely, and depression is associated with a low extraversion. Other personality indicators could be temporary but rapid mood changes, short-term hopelessness, loss of interest in activities that used to be a part of one's life, sleep disruption, withdrawal from previous social life, appetite changes, and difficulty concentrating. Alcohol can be a depressant which slows down some regions of the brain, like the prefrontal and temporal cortex, negatively affecting rationality and memory. It also lowers the level of serotonin in the brain, which could potentially lead to higher chances of depressive mood. Social abuse, such as bullying, are defined as actions of singling out and causing harm on vulnerable individuals. In order to capture a day to day observation of the relationship between the damaging effects of social abuse the victim's mental health and depressive mood. A study, they do conduct a lot of studies, psychology, psychiatry. Okay, a study was conducted on whether individuals would have a higher level of depressed mood when exposed to daily acts of negative behavior. What gives joy to one person may lead to sadness for the other person. It's not the same for everybody. The result concluded that being exposed daily to abusive behavior such as bullying as a positive relationship to depressed mood on the same day. Depression may also be the result of health such as with the medication-induced depression. Therapies associated with the depression include interferon therapy, beta blockers, isotretinoin, contraceptives, cardiac agents, anticonvulsants, anti-migraine drugs, antipsychotics, hormonal agents such as gonadotropin, releasing hormone agonists, magnetic stimulation to brain, and electric therapy. Several drugs of abuse can cause or exacerbate depression, whether in intoxication, withdrawal, and from chronic use. These include alcohol sedatives, including prescription benzodiazepines, opioids, including prescription painkillers, and illicit drugs such as heroin, stimulants such as cocaine and amphetamines, hallucinogens, and inhalers. Depressed mood can be the result of number of infectious diseases, nutritional deficiencies, neurological conditions, and physiological problems, including hypoandrogenism in men, Addison's disease, Cushing syndrome, hypothyroidism, hyperparathyroidism, Lyme disease, multiple sclerosis, Parkinson's disease, chronic pain, stroke, diabetes, and cancer. A number of psychiatric syndromes feature depressed mood as a main symptom. The mood disorders are a group of disorders considered to be the primary disturbances of mood. These include major depressive disorder, MDD, commonly called major depression and clinical depression, where a person has at least 2 weeks of depressed mood or loss of interest or pleasure in nearly all activities, and dysthymia, state of chronic depressed mood, as the symptoms of which do not meet the severity of a major depressive episode. Another mood disorder, bipolar disorder, features one or more episodes of abnormally elevated mood, cognition, and energy levels, but may also involve one or more episodes of depression. And the course of depressive episodes follows a seasonal pattern. The disorder, major depressive disorder, bipolar disorder, etc., may be described as a seasonal affective disorder. Outside the mood disorders, borderline personality disorder often features an extremely intense depressive mood. Adjustment disorder and depressed with a depressed mood is a mood disturbance appearing as a psychological response from identifiable event or a stressor in which the resulting emotional or behavioral symptoms are significant but do not meet the criteria for a major depressive episode. And post-traumatic stress disorder, PTSD, a mental disorder that sometimes follows trauma, is commonly accompanied by depressed mood. Measures of depression as an emotional disorder include, but are not limited to, Beck Depression Inventory 2, a 9-item depression scale in Patient Health Questionnaire, PHQ-9. Both of these measures are psychological tests that has personal questions of the participant and have mostly been used to measure the severity of depression. The Beck Depression Inventory, BDI, is a self-report scale that helps a therapist identify the patterns of depression symptoms and monitor recovery. The responses on this scale can be discussed in therapy to devise interventions for the most distressing symptoms of depression. Another measure of depressed mood would be the IWP Multi-Affect Indicator. It's a psychological test that indicates various emotions such as enthusiasm and depression and asks for the degree of the emotions that the participants have felt in the past week. There are studies that have used lesser items from the IWP Multi-Affect Indicator, which cause them scale down to daily levels to measure the daily levels of depression as an emotional disorder. Divergent thinking is defined as a thought process that generates creativity and ideas by exploring many possible solutions. Having a depressed mood will significantly reduce the possibility of divergent thinking as it reduces the fluency, variety, and the extent of originality of the possible ideas generated. However, some depressive mood disorders might have a positive effect for creativity. Schools of depression theories include cognitive theory of depression, tripartite model of anxiety and depression, behavioral theories of depression, evolutionary approaches to depression, biology of depression, epigenetics of depression. Depressed mood may not require professional treatment and may be a normal temporary reaction to life events, a symptom of some medical condition or a right side effect of some drugs or medical treatments. A prolonged depressive mood, especially in a combination with other symptoms, may lead to a diagnosis of psychiatric or medical condition and may benefit from treatment. The UK National Institute for Health and Care Wellness (NICE) 2009 guidelines indicate that antidepressants should not be routinely used for initial treatment of mild depression because of risk-benefit ratio is poor. Physical activity can have a protective effect against the emergence of depression. Physical activity can also decrease depressive symptoms due to the release of neurotropic proteins in the brain that can help to rebuild the hippocampus that can be maybe reduced due to depression. Also, yoga could be considered an ancillary treatment option for patients with the depressive disorders and individuals with elevated levels of depression. Reminiscence of old and fond memories is another alternative form of treatment, especially for the elderly. Most of the elderly live in isolation now, who have lived longer and have more experiences in life. It's a method that causes a person to recollect memories of their own life, leading to a process of self-recognition and identifying familiar stimuli. By maintaining one's personal past and identity, it's a technique that stimulates people to view their lives in a more objective and balanced way, causing them to pay attention to positive information in their life stories, which would successfully reduce depressive mood levels. There are empirical evidences of a connection between the type of stress management techniques and the level of daily depressive mood. Problem-focused coping leads to lower level of depression. Focusing on the problem allows for the subjects to view the situation in an objective way, evaluating the severity of the threat in an unbiased way. Thus, it lowers the probability of having depressive responses. On the other hand, emotion-focused coping promotes a depressed mood in stressful situations. The person has been contaminated with too much irrelevant information and loses focus on the options for resolving the problem. They fail to consider the potential consequences and choose the option that minimizes stress and maximizes well-being. Depression is the leading cause of disability worldwide. The United Nations UN Health Agency reported estimating that it affects more than 300 million people worldwide. This is an old figure, actually. The majority of them women, young people, and the elderly. An estimated 4.4% of the global population suffers from depression, according to a report released by the UN World Health Organization (WHO), which shows an 18% increase in the number of people living with depression between 2005 and 2015. Depression is a major mental health cause of disease burden. Its consequences further lead to significant burden in public health, including a higher risk of dementia, premature mortality arising from physical disorders, and maternal depression impacts on child growth and development. Approximately 76% to 85% of depressed people in low and middle income countries like India do not receive treatment. Barriers to treatment include inaccurate assessment, lack of trained healthcare providers, social stigma, and lack of resources. The stigma comes from misguided societal views that people with mental illness are different from everyone else and they can choose to get better only if they wanted to. Due to this, more than half of the people with the depression do not receive help with their disorders. The stigma leads to a strong preference for privacy. WHO has constructed guidelines known as the Mental Health Gap Action Program (MHGAP), aiming to increase services for people with mental, neurological, and substance abuse disorders. Depression is listed as one of the conditions prioritized by the program. Trials conducted show possibilities for the implementation of the program in low-resource primary care settings dependent on primary care practitioners and health care workers. Examples of MHGAP endorsed therapies Targeting depression include group interpersonal therapy as group treatment for depression and thinking health, which utilizes cognitive behavioral therapy (CBT) to tackle perinatal depression. Furthermore, effective screening in primary care is crucial for the access of treatments. MHDAP adopted its approach to improving detection rates of depression by training general practitioners. However, there is still weak evidence supporting this training. APA's clinical practice guidelines, American practice guidelines recommend 7 psychotherapy interventions as well as a second generation antidepressant. Selective serotonin reuptake inhibitors, SSRI, serotonin norepinephrine reuptake inhibitors, SNRI, or norepinephrine dopamine reuptake inhibitors, NDRI, for the treatment of depression in adults. Behavioral therapy focuses on the relationship between behavior and mood. Yeah, our behavior is dependent on the mood, actually, to target current problems and symptoms and focus on changing patterns of behavior that lead to difficulties in functioning. Cognitive therapy entails modifying pessimistic evaluations and unhelpful thinking patterns with the goal of disrupting these and reducing their interference with the daily life. Cognitive behavioral therapy. Now, cognitive behavioral therapy has become so popular for so many things, targets current problems and symptoms, and focuses on recognizing the relationship between behaviors, thoughts, and feelings, and changing patterns that reduce pressure and interfere with the person's ability to function at his or her best. Interpersonal psychotherapy, IPT, shortly, focuses on improving problematic relationships and circumstances that are most closely linked to the current depressive episode. We call it as episodes because it lasts only for a short time. Mindfulness-based cognitive therapy, MBCT, combines strategies cognitive therapy with mindfulness meditation to modify unhelpful thoughts and develop a kind or more loving self-view. Psychodynamic theory focuses on unconscious thoughts, early experiences, and the therapeutic relationships to understand current challenges, improves self-awareness, and support the patient in developing more adaptive patterns of functioning. Supportive therapy offers supportive relationship that focuses on helping people explore and understand their experience in their current situation. The focus is on strengthening the person's ability to make choices that help them cope effectively with the various life stressors from a stance of genuine empathy and supportive listening. Diagnosis and treatment of depression. Look for signs of depression. Consult with your doctor, medical doctor. Research depression for better understanding. Try talk therapy. Consider taking prescription medicines. Try alternate therapies or remedies. Make lifestyle changes. Sleep well, exercise, eat healthy, restore any neglected grooming, maintain a good support network, be around positive people. That is most important. Some people always try to demoralize you. Stay away from such people. They are like poison. How to change your behavior? Keep occupied, do fun things, and treat yourself. Start a journal of your journey through your depression. Help others. How to change your negative thinking patterns? Think of it as a journey to wellness. Understand the importance of overcoming negative thinking. Change your thinking. Look for the good. Change the way you talk. Accept the fact that depression may return. Depression is a symptom of some physical diseases, the side effect of some drugs and medical treatments, and a symptom of some mood disorders such as major depressive disorder, dysthymia. Physical causes are ruled out with a clinical assessment of depression that measures vitamins, minerals, electrolytes, and hormones. Management of depression may involve a number of different therapies, medications, behavior therapy, psychotherapy, and medical devices. Though psychiatric medication is the most frequently prescribed therapy for major depression, psychotherapy may be effective either alone or in combination with the medication. Medication, it is better that you avoid or reduce. So, combining psychotherapy and antidepressants may provide a slight advantage, but antidepressants alone or psychotherapy alone are not significantly different from other treatments or active intervention controls. Given an accurate diagnosis of major depressive disorder, in general, the type of treatment for psychotherapy and or antidepressants, alternate or other treatments or active intervention is less important than giving depressed patients involved in an active therapeutic program. Psychotherapy is a treatment of choice in those under the age of 18 with the medication offered only in conjunction with the pharma and generally not as a first-line agent. The possibility of depression, substance misuse, abuse, or other mental health problems in the parent should be considered, and if present, and if it may help the child, the parent should be treated in parallel with the child. There are a number of different psychotherapies for depression which are provided to individuals or groups by psychotherapists, psychiatrists, psychologists, clinical social workers, counselors, or psychiatric nurses. With the more chronic forms of depression, the most effective treatment is often considered to be a combination of medication and psychotherapy. As the most studied form of psychotherapy for depressive cognitive behavioral therapy, as I told you before, CBT is thought to work by teaching clients to learn a set of cognitive and behavioral skills, which they can employ on their own. Behavioral therapy for depression is sometimes referred to as behavioral activation. As a person, you should understand your body. You have a better understanding of your body than anybody else in this world. Emotionally focused therapy, founded by Sue Johnson and Les Greenberg in 1985, treats depression by identifying and processing underlying emotions. Acceptance and commitment therapy, ACT, a mindfulness form of CBT, which has its roots in behavioral analysis, also demonstrate that it's effective in treating depression and can be more helpful than traditional CBT, especially where depression is accompanied by anxiety and where it is resistant to traditional CBT. A review of 4 studies on the effectiveness of mindfulness-based cognitive therapy, MBCT, a recently developed class-based program designed to prevent relapse, suggests that MBCT may have an additive effect when provided with the usual care in patients who have had 3 or more depressive episodes, although the usual care did not include antidepressant treatment. Or any psychotherapy, and the improved observed may have reflected non-specific or placebo effects. Of note, although MBCT for depression prevented relapse of future depressive episodes, there is no research on whether it can cause the remission of a current depressive episode. Interpersonal psychotherapy, IPT, focuses on the social and interpersonal triggers that may cause depression. There is evidence that it's an effective treatment for depression. Here, the therapy takes a fairly structured course, often 12 sessions as in the original research versions and as in the case with CBT. However, the focus is on relationships with others. Unlike family therapy, IPT is an individual format, so it is possible to work on interpersonal themes even if other family members do not come to the session. Therapy can be used, it should be structured to the individual. Group therapy won't work. Therapy can be used to, anything should be customized, specifically tailored to meet the demands. Intervention. Okay, so therapy can be used to help a person develop or improve interpersonal skills in order to allow him or her to communicate more effectively and reduce stress. In a meta-analysis of 16 studies and 4,356 patients, the average improvement in depressive symptoms was an effect size of D equal to 0.63 95% CA, 0.3 to 0.9. IPT combined pharmacotherapy with other effective in preventing was more effective in preventing relapse than pharmacotherapy alone. Number needed to treat is equal to 7.63. Psychoanalysis, a school of thought founded by Sigmund Freud that emphasizes the resolution of unconscious mental conflicts, is used by its practitioners to treat clients presenting with the major depression. A more widely practiced technique called psychodynamic psychotherapy is loosely based on psychoanalysis and has an additional social interpersonal focus. In meta-analysis of 3 controlled trials, psychodynamic psychotherapy was found to be more effective, as effective as medication for mild to moderate depression. Shared decision making is an approach whereby patients and clinicians freely share important evidence when tasked with the decision making, and where patients are guided to consider the best available options to make an informed decision. That is most important. As the individual, we should make an informed decision. As I told you, we know our body much better than anybody else in this world. To find of course, God knows, to find the most effective pharmaceutical drug treatment, the dosages of medication must often be adjusted. Different combinations, evidence-based treatment. That's a concept nowadays, evidence-based. Different combinations of antidepressants. I was trying to get out. Okay, antidepressants tried or antidepressants. Prozac, zinc, norepinephrine reuptake inhibitor (NRIs) can be used as antidepressants. Selective serotonin reuptake inhibitors (SSRIs) such as sertraline, Zoloft, Lestrol, escitalopram, Lexapro, Cipralex, Fluoxetine, Prozac, as I told you, paroxetine, Serozac, and citalopram are the primary medications considered due to the relatively mild side effects and broad effect on the symptoms of depression and anxiety, as well as reduced risk in overdose compared to the older tricyclic alternatives. As much as possible, stay away from allopathic medicines. All these allopathic medicines have so many side effects, adverse side effects, like vaccines, you know that. Those who do not respond to the first SSRI tried can be switched to another. If sexual dysfunction is present prior to the onset of depression, SSRI should be avoided. Another popular option is to switch to the atypical antidepressant bupropion, Wellbutrin, or to add bupropion to the existing therapy. This strategy is possibly more effective. Stay away from steroids. Even for this thing, COVID-19, they tried out steroids. People are dying because of that. Steroids are bad. One should avoid, one should never take steroids for anything, whether it be for any sports activity or treatment, because steroids, it will lead to substantial reduction in your natural immunity. That's very bad. It's not uncommon for SSRIs to cause or worsen insomnia. The sedating, good doctors will not recommend steroids. They will stay in, I will not prescribe steroids. The sedating, no adrenergic and specific serotonergic antidepressants, NASA antidepressant, metazapine, Cysteine, Remeron can be used in such cases. So many doctors say, Remdesivir should not be used for treatment of COVID-19. But so many private doctors, especially working with the private hospitals, who are looting money from the innocent, are prescribing this Remdesivir. Government is against Remdesivir. Okay, cognitive government can be used in such cases. Cognitive behavioral therapy for insomnia can also help to alleviate the insomnia black marketing without Remeron can be used in such cases. Cognitive behavioral therapy for insomnia can also help to alleviate the insomnia without additional medication. Venlafaxine effects are from the SNRI class be moderately more effective than SSRI. Antidepressants are really bad. Avoid. However, it is not recommended as a first-line treatment because of the higher rate of side effects, and its use is specifically discouraged in children and adolescents. Fluoxetine is the only antidepressant recommended for people under the age of 18. So, if a child or adolescent patient is intolerant to fluoxetine, another SSRI may be considered. Evidence of effectiveness, evidence-based treatment. Evidence of effectiveness of SSRIs in those with depression complicated by dementia is lacking. Tricyclic antidepressants similarly prescribing antibiotics for anything and everything is bad. That leads to what we call as superbugs. Okay, tricyclic antidepressants, TCAs, have more side effects than SSRIs, but less sexual dysfunctions, and are usually reserved for the treatment of inpatients. So many doctors prescribe antibiotics for anything and everything, even for mild infections. Antibiotics is not a treatment for viral infections, like this thing, no? What is it? COVID-19. Classic example. Treatment of inpatients for whom the tricyclic antidepressant amitriptyline in particular appears to be more effective. Different class of antidepressants, the monoamine oxidase inhibitors, have historically been plagued with questionable efficacy, although early studies use dosages now considered too low and life-threatening adverse effects. They are still used only rarely, although newer agents of this class, RAMA, with a better side effect profile has been developed. In older patients, TCAs and SSRIs are of the same efficacy. However, there are differences between TCA-related antidepressants and classical TCAs in terms of side effect profiles and withdrawal when compared to SSRIs. There is evidence a prominent side effect of antidepressants, emotional blunting. Emotional blunting. Good term. Is confused with the symptom of depression itself. A 2012 cross-sectional study found an association between zinc deficiency and depressive symptoms among women but not men. And a 2013 meta-analysis of 17 observational studies found that blood zinc concentrations were lower in depressed subjects than in controlled subjects. A 2012 meta-analysis found that zinc supplementation as an adjunct to antidepressant drug treatment significantly lowered depressive symptom scores. Of depressed patients. The potential mechanisms underlying the association between low serum zinc and depression remain unclear, but many may involve the regulation of neurotransmitter, endocrine, and neurogenesis pathways. Zinc supplementation has been reported to improve symptoms of ADHD, attention deficit hyperactivity disorder, and some depression. A 2013 review found that zinc supplementation may be an effective treatment in major depression. Many studies have found an association between magnesium intake and depression. Magnesium was lower in serum of depressed patients with uncontrolled. One trial found magnesium chloride to be effective for depression in seniors with type 2 diabetes, while another trial found magnesium citrate decreased depression in patients with fibromyalgia. One negative trial used magnesium oxide. It is poorly observed. A randomized open-label study found that consumption of magnesium chloride for 6 weeks resulted in a clinically significant net improvement in depression, and that effects are observed within 2 weeks. Physicians often add a medication with a different mode of action to bolster the effect of an antidepressant in cases of treatment resistance. Antidepressants are statistically superior to placebo, but their overall effect is low to the risk factors, low to moderate. So, the risk factor for treatment the risk factors for treatment-resistant depression are the duration of episode of depression, severity of the episode, if bipolar, lack of improvement in symptoms within the first couple of treatment weeks, anxious, avoidant, and borderline comorbidity in old age. Treatment-resistant depression is best handled with a combination of conventional antidepressant together with a atypical antipsychotics. Another approach is to try different antidepressants. A variety of medical devices are in use or under consideration for the treatment of depression, including devices that offer electroconvulsive therapy, vagus nerve stimulation, repetitive transcranial magnetic stimulation, and cranial electrotherapy stimulation. The use of such devices in the United States requires approval by the US Food and Drug Administration (FDA) after field trials. Bright light therapy. Bright light is also used as a therapy. It's sometimes used to treat depression. Especially in its seasonal form. Physical exercise is one recommended way to manage mild depression, such as playing soccer. Mindfulness meditation programs may help improve symptoms of depression, but they are no better than active treatments such as medication, exercise, and other behavioral therapies. A 2009 review found that 3 to 7 sessions of music therapy resulted in a noticeable improvement in depressive symptoms, with a greater improvement after 16 to 51 sessions. Depression is sometimes associated with insomnia, difficulty in falling asleep, early waking, or waking in the middle of the night. The combination of these two, depression and insomnia, will only worsen the situation. Hence, good sleep hygiene is important to help break this vicious circle. It's a vicious circle. It would include measures such as regular sleep or routines, avoidance of stimulants such as caffeine, and management of sleeping disorders such as sleep apnea. Quitting smoking cigarettes is associated with reduced depression and anxiety, with the effect equal to or larger than those of antidepressant treatments. 10 best techniques to manage depression. Identify triggers, plan new resources, start where you already are, cool down burnout, mobilize energy, end isolation, balance your life, prevent destructive behavior, broaden your perspective, increase flexibility, learn to live fully. Debates, discussion on open-ended topics like this can go on forever. Anyhow, let me pull the plug here. We'll meet again real soon with another interesting topic. Some of the statements used express are solely mine, based on limited knowledge gained over 6 decades of versatile experience. Always watch these videos with a closed caption, subtitles for absolute 100% comprehension as per my sincere recommendation, zillion times so far. I know I rushed through to complete the presentation within 20 minutes maximum. This time and rate is self-imposed to retain the viewer's attention as a norm. I am quite aware of the fact that I exceed this time limit. Sometimes I take double or even triple. Today I must take about double time. I'm not looking at the clock, depending on the topic. Since I make honest attempts to cover a selected topic more elaborately, including so many intricate fine details, referring a wide variety of sources, in particular Wikipedia, quite extensively, besides articles and books published recently. Besides, of course, I sprinkle my own salt and pepper and season it with my personal experiences so far in my life and also intuition. Stay at home as much as possible to maintain social distancing attributed to pandemic novel COVID-19 and prolong your lifespan. Lead a healthy life. God, also known as the supreme power, is the one and only one who can put a stop to natural, unnatural, maybe bio or cyber war events like pandemics and epidemics, which ultimately paves the way for apocalypse and extinction of our sentient species on Earth for no fault of ours. It looks like all these symptoms make me think that it's apocalypse season. Rest in peace and harmony. In Hindu mythology, we call it as Kali Yuga. Rest in peace and harmony. Yeah, today I have taken about double the time. Great. My judgment